All right, it's time to ask the pet doctor today, and Jillian front and center here this morning with Dr. Jerome Williams. Good morning.
Good morning.
It's good to see you.
Good to be here.
Hello. Oh, we woke you up too early. All right, we'll get right to our questions, and we have a few questions here. So our first one is, are you seeing a lot of flea and tick activity this time of year as opposed to winter?
Yes, going into the cold or freezing weather time of year, we're going to see ticks. When it freezes or it's very cold, you see a lot less activities. But fleas are the #1 cause of scratching and itching among pets.
And they affect different dogs different ways.
Yes, yes. And same as with people. You know, fleas will bite some people and not others.
Yeah, I've been in a situation, I've said, there's something in biting me, and I figured out it ended up being fleas, and somebody else said, well, I don't feel anything. It's like mosquitoes with some people.
The same, exactly the same, yes.
Okay, so are you seeing a lot more GI issues right now? And what do you think the cause of this is if you are?
We're seeing it, but I don't know what the cause is.
And when you say what's happening?
We're seeing some severe GI problems with bloody diarrhea,
Oh my goodness.
vomiting, and
like more than normal you're
more
seeing?
than normal. It's requiring a more aggressive treatment than normal, which means we got to put them on IV fluids. Some of those we're not sure about what's happening. We have to do barium studies on them. So we're seeing more, but why, I don't know.
So what's your advice? I mean, anytime you see something abnormal, bring them in to be checked.
Get them in. You don't want them to get too far where we have to really do that much more informal treatments.
Okay, have you been seeing a lot of allergy or allergen issues this year?
Beginning to. We're beginning to get in the allergy season, the fall allergy season. So we're beginning to see a little more of that. That's usually respiratory. Occasionally it's contact. Most time it's respiratory.
So what's happening with the dog when it's respiratory? Do they sneeze and cough like we do?
Yes, exact same. You'll see them hacking more. Sometimes it'll get so bad that they're hard to want to eat normally.
So do you put them on medicine like you put a human on?
Benadryl might work.
Okay.
You give that at the dose of 1 milligram per pound twice a day. You can try that first. If that doesn't work, then see a veterinarian. Okay,
and those are some of the things you can do to reduce it in the beginning, or is there anything? It's just going to happen?
The biggest thing that we want to do year-round is keep our filters changed in our homes because dust mites and other particles can help exacerbate those allergies. So that's the main thing to do inside the home. Now
fleas, we know, are irritating and they can be very, very bothersome, but ticks can be very dangerous.
Yes, yes.
Talk about the difference there.
Well, fleas carry tapeworm as the major cause of it being a vector. Ticks can cause a number of diseases, both in dogs and in people. Lyme disease in people.
Which is awful.
Awful. It's a life-affecting disease. But ticks can cause paralysis and a lot of other vector diseases, 3 or 4 that come to mind right away. Okay,
if you discover a tick on your dog, how do you remove it?
Because
I've seen people try to pull it.
The debate has been all over the place.
Yeah, because it really is. It hooks itself into the body.
Yes. I think the prevailing recommendation now is to remove it.
Okay.
Back in the day, it was suggested that you want to put something on it to make it withdraw its head, so you wouldn't leave the head in. But the prevailing recommendations now seem to be to remove it with something, with tweezers or something like that.
Just the thought is making Jillian a little uncomfortable right now. I can tell. All right. Well, some great questions and answers this morning from Dr. Jerome Williams and Jillian here today. Good to see you.
Good to be here.
Okay. See you next time.
Okay.
All
Take care.
Now let's check in with JJ.